Welcome everyone to the Advocacy Exchange. I am David Craig, CEO of Grit Health, and we are the partners to Bristol Myers Squibb in bringing this Advocacy Exchange to life. Before we get underway today, there are a couple of really important moments we want to take a second to honor. And so if it's okay, I'd like to start with a few comments. And that is to share that now we have had 112 humans on as speakers in the Advocacy Exchange since we started in May of 2020. And each one of these speakers has shared not only their expertise, but their deep human experience and what it's like to live that firsthand from the individual going through that experience. Almost immediately after we launched the Advocacy Exchange, BMS introduced us to KT Jones. KT had spoken at several events with BMS over the years, and the team wanted him to share his voice and his experience with this Advocacy Exchange community. KT became one of our very first speakers in a session in July of 2020 that we titled Reshaping Healthcare, Thinking Differently After COVID. In his introductory comments, KT shared that he was originally diagnosed with Hodgkin's lymphoma in 2002, and he was then given a terminal diagnosis in 2011. With a smile on his face that anybody who knows KT has seen, he went on to say, "But I'm still here." And it is because of his relentless advocating for himself and for others that he was able to find a treatment option and ultimately to get into remission. In the end of 2001, KT was re-diagnosed with squamous cell cancer with no known cause. And sadly, I have the profound news to share that KT passed away on Friday last week. We wanted to take a moment to honor KT and his voice, both in this Advocacy Exchange and in everybody's lives that he touched, and to ask all of us to please keep KT in your hearts and in your actions as we think about affecting the global advocacy community. For me personally, KT inspired me to see what is possible in the face of impossible odds. And his inspiration has affected so many of us on the BMS, the Grit Health, and everyone here in this community. Also keeping KT in our heart, I'd like to take a moment and ask for a minute of silence, specifically to honor all of the patients, the caregivers, the advocates, the providers and professionals, and everybody who is facing trauma, especially everybody overseas that's dealing with what they're going through. Let's please take a moment of silence together. Thank you very much for honoring everybody who needs our support. I think the only way to transition into this important conversation today is to say that it is as much about, and perhaps even more importantly, about the human experience of health and healthcare that we go through that really drives us to try to make things better. And just to share with you quickly to frame why this is so important to me, it was after my second cancer diagnosis in my 20s that I was referred to an endocrinologist because my body was no longer producing hormones. And the issues that I was facing were different than every other patient that was in that waiting room. He specialized primarily in older men dealing with prostate cancer and other issues. And although that doctor gave me the exact same care he gave every other patient in that waiting room, which he told me repeatedly, the experiences I was going through as a 30-year-old with loss of fertility and all the other things were never brought up or discussed. It is for those reasons that I didn't fit in the healthcare system and left to try to create change together. what I've learned now, having spent a career as a patient experience researcher, is that the labels that we use so dependently to try to start to know how to treat somebody can actually be the cause of how mistreating them can actually happen. These individuals, these humans that you're going to hear from today and get to share your experiences with it all, are experts in that. They have lived this experience and they will lead a courageous and powerful conversation. And what I'd like to ask everybody to please keep in your hearts as I hand it over to Dr. Brad Love to moderate this conversation is that the beautiful thing about patient experience is that there is no right or wrong. It is how we as humans experience what we're going through. And I can't think of anybody who spent his career more living that than Dr. Brad Love. Please help me welcome Brad.
Thank you, Dave, for setting us up with that focus on humanity and sharing the difficult news about KT. Thank you all for being here. You're very welcome to the session of the Advocacy Exchange, and we are honored to have your presence building on KT's legacy as we seek to empower, build, and create more powerful advocacy, as you do through the work that you do every day. Obviously, we're here today, as David mentioned, to think about health equity through the lens of gender because of how transformational it is in the ways that care happens or does not happen in some complexities. To start us off, if I may, I'd like to open a quick poll question to get a bit of a baseline to see where our team is starting as it relates to these questions. So a poll should pop up momentarily asking you the question, has your gender impacted your journey in healthcare? And it will take a minute for that to fill in, and we'll be able to share results, which will give us our starting point for today's conversation before we move into our speakers and have them introduce themselves. And so if we have results, if we could share those, production team, okay, fantastic. And one of the things for us to think about then today is recognizing just how very impactful this is to everyone. We see about 2/3 of you are recognizing ways that gender has mattered, but also a lot, about a fifth, saying, I don't know. And one of the points we want to make with this question is just to help us all frame, if you'll allow a gentle nudge from me, the fact that almost no matter what your personal circumstances are, gender has affected your healthcare. If you've ever had a prostate exam or a mammogram, been to an OBGYN, it's affected your healthcare. It's something we often look past as individuals because we just live our day-to-day experiences. But the fact of the matter is, it's something to be considered and something our providers can often seek to consider as well, but might need a gentle nudge from your advocacy lens. So that said, to think about people who are leading the thinking in this space and to bring some more voices into this conversation. Beginning with Jamie, I'd like to ask each of our three panelists to take a few minutes to introduce themselves, their backgrounds, and why the topic is important to you. Jamie, we'd love to hear from you.
Good morning, everybody. I would first like to start by thanking the Advocacy Exchange and Bristol Myers Squibb and Grit Health for hosting and facilitating this really important discussion. This team has been a dream to work with, and I'm so grateful to be invited into this space with these remarkable individuals, Chris and Tyler, to discuss issues that are really important to us. My name is Jamie Agunsday, and I'm a registered nurse from New Jersey. I've been a nurse for almost 8 years now. I was inspired to go to nursing school and become a nurse after having my daughter. And deciding if I was going to spend time at work away from her, I wanted to make sure I was doing something that was really meaningful to me that helped others. I went right into labor and delivery nursing, where I spent more than 7 years serving growing families here in New Jersey, where I've lived nearly all my life. And becoming part of the story of a family and being present for birth has been the greatest professional honor that I have ever had. It's been so meaningful to me in this career. So the topic of gender and health outcomes is really important to me for both personal and professional reasons, a lot of which intersect. I am a woman and a mother of 2 young children. I am a survivor of intimate partner violence, and I'm someone who has experienced depression and postpartum depression multiple times throughout my life. And I'm a woman and mother who's trying to navigate life and motherhood without the guidance of my own mother, who died from cancer 5 years ago when my son was only about 12 months old and my daughter was 5. So I try to blend my work and personal experiences as an advocate to make improvements in maternal child health and make it safer for women and birthing people to grow their families. And in this conversation, I hope to bring my experiences as a healthcare provider and a nurse as it's informed by my life experiences. And I'm so excited to be here to do it. So thank you.
Absolutely. Thank you for sharing all of that. And we look forward to hearing more. Next, we'll head over to Tyler. Tyler, if I could ask you to introduce yourself. Before you do so, very quickly, if I may insert a quick ad into our program today. Tyler had a book come out about a month ago that I encourage everyone to look at, called The Ball Came Out: Life from the Other Side of the Field. So as a means of supporting each other and thinking about ways to spread advocacy, Tyler's book is a key example, and we look forward to hearing more. Tyler, please.
Dr. Love, thank you so very much. With a name like that, it really makes me feel the ability to be vulnerable, man. Dr. Love, you know what I'm saying? Everybody, I want you to picture yourselves in a doctor's office, right? A neurologist, to be specific, right? You're in this situation and you're in this predicament largely because you're experiencing paralysis down the right side of your body. You can't feel your right arm or your right leg. You developed a neck jerking twitch that causes people to look constantly at you in the face, trying to figure out what exactly is going on with you. On top of all this, your speech is slurred and your equilibrium is totally shot, which means every time that you try to walk and raise to your feet, you fall helplessly to the floor like that of an infant child who's learning how to try to walk for the very, very first time. That's the predicament that I found myself in at the age of 21 while attending San Diego State University on a full ride football scholarship. And I'll never forget walking into the neurologist's office and seeing the nurses and checking in, and an elderly white woman looked at me and she said, "Son, what are you doing here? You're much too young to be here. And normally there are a lot more women here." And as soon as I got that remark, that's what led me to the patient table that I just introduced you all the scenario. And the doctor came in, and as soon as she came in, y'all, her eyes leaped. And I don't know about y'all, but like I read body language very quickly even when people aren't like talking. And when I saw her eyes leap, when she turned around and saw me on the patient table, that meant she had never seen somebody like me. And when I was diagnosed with multiple sclerosis, I was incredibly scared because I never forget the white woman who told me that I was never seen somebody like me before. And then I saw the doctor's eyes jump when she saw me. And when I Googled multiple sclerosis, don't hit Dr. Google, y'all. You're not supposed to do that. But when I did, because I didn't know, I never saw anybody who looked like me. And I didn't see that needed need of a Black male to look like me to tell me it was going to be okay. And from that moment on, I vowed to leave things better than the way that I found them, to become a patient advocate for multiple sclerosis, because I needed another Black male to never, ever be in the position or the predicament that I found myself into. And so it became my life's work ever since. My life became my message, Dr. Love. And that's why I'm incredibly happy to be here today, because we got to break down barriers and also give people encouragement.
Love it. Thank you for sharing that. And to follow up, thinking of incredibly encouraging people, we have our third speaker. Chris, could I ask you to introduce yourself?
Yeah, hi everybody. My name is Chris Tremaris. My pronouns are they, he, and I am grateful to be here with everybody who's joined in for this conversation and super grateful to be working with Grid Health. I'm part of their community team and I work with Lauren to kind of have these sessions and these moments where we can be vulnerable and talk about what's going on. And now I'm on the spotlight to share my vulnerability. So there are going to be moments I'm a little anxious, just bear with me. But a little bit about my background and why am I here. My education experience has been very much around healthcare. I got my undergrad in psychology, and at the same time, I was an EMT giving direct medical care in emergency situations. And at the same time, I was coming out as transgender. So I was assigned female at birth and knew from a very young age of 5 years old that I wasn't in the right body. But there was so much stigma around about what it meant to be transgender. And at the time they were calling it transvestite. There were a lot of slur words and a lot of negativity. So I learned quickly at a young age to hide certain parts of myself to just get through the moments. And it wasn't until I got to 21 that I was able to finally come back out of that closet after probably a decade of having internal discussions with myself if it was worth that or not. I mixed up my stories, but it's okay. So beyond that, after kind of coming out and doing this whole experience of coming out while I was in undergrad and trying to figure out what the next steps were, I had also previously applied to Peace Corps. And so I put that transition on hold to go to Moldova, where I was there for 2 years teaching in Romanian healthcare to second graders all the way to eighth graders. And there's nothing more awkward than teaching puberty to eighth graders when you barely know the language. But from there, I kind of made that work where I was in this in-between quasi legally a woman, but very much acting and looking and presenting as a man. Granted, I hadn't done hormones, so no beard at that point. I still had hair. But after my time in Peace Corps, I came back to Brandeis University to do an MBA and an MS in global healthcare management, because from a very young age, I saw how much healthcare plays such a big role in societies being healthy and strong, and individuals being able to kind of fulfill what they're meant to do. And if we can't create systems where people can go to seek the care they need, then how are we ever going to move forward as a society, as a community, as whatever term we want to use? So I kind of have always been in healthcare, and it's been my experience in healthcare that's allowed me to advocate for myself. It was from when I was an EMT that I was able to gain the language I needed to talk to medical professionals, to be able to argue or discuss against them, and to be able to say, this isn't working out, and I'm going to go find something else or somebody else. It is from my understanding of how healthcare works from my graduate experience that I can understand and kind of see where there are these moments of opportunity and how can we expand what we're doing to really get at the data and get at what we want to get at. So,
Thank you, Chris. Thank you for sharing. There's such power in your vulnerability, and we appreciate it. And the same being true for Jamie and Tyler sharing their experiences as well. And obviously, we're blessed to have you on the Grit Health team. So thanks for being here in a few ways today. If I might stick with you, Chris, and pass a similar question to our other two guests, could I ask you to describe a little bit more, as you touched on in your introduction, how stigma has played into gender in healthcare in your life?
Yeah, absolutely. So I mentioned I was assigned female at birth, and initially I transitioned to being male, and all my documents now are man, and now I'm kind of going in this gender space where it's between. And I mentioned this because each one had its own stigmas associated with it, right? Navigating the healthcare field as a woman and being viewed as a woman had its own challenges that were shifted and changed as I gained language to be able to communicate with medical providers on a level that they understood. And then as I kind of transitioned into this in between where I had started hormones, but not always consistently presenting as male, or even before that presented its own issues too. And then even post, after transitioning, suddenly I still require just gendered care, right? Like the GYN, but I'm very obviously not supposed to be there. I don't even fit in the androgynous label that I could have passed off before. So now it's very much of, I'm in this awkward position of everybody kind of can figure out why I'm there, and it very much outs me. And now that I'm in this agender, again, another set. So to go back, navigating the healthcare field as a woman, it's very, what I realize is medical providers don't listen. It's very hard to get providers to see and to understand what's going on. And it's different when you have the language and you know which keywords to use, because it rings like the checklist off. And then they're like, okay, now I understand how to do this. And now I understand I need to do this. And it was very much of, if I said I had this pain at this level, it was not viewed at the same rate of when I was viewed as a man, and even in between in this androgynous space. So it's, unfortunately, these stigmas come from these gendered stereotypes that we prescribe to. And it's, how do we expand that, right? So going back to the original question, it's very much dependent on the cultures and the situations, and is present everywhere, and is present in so many different situations at layers that we're just now starting to understand.
Yeah, I appreciate that. It's powerful framing. Tyler, could I come to you next with the same topic about how stigma has played into gender and healthcare in your life?
Yeah, absolutely. When getting diagnosed, I was hit with a lot of different things physically to look for. As you can imagine, as we all can imagine on this panel, we know that um, erectile dysfunction was never discussed. And it was already a battle to know that as a man, Black man, you weren't seeing as many faces. And then to know that it hits you in quote unquote, what you deem to be your manhood, that now you're having problems at the age of 21, and it never got spoken or covered within a doctor's office. And it just further, I already felt like I was an anomaly. I was an outlier. Now, oh my gosh, we have this space of erectile dysfunction that I was never warned about. It made me feel like now that I have erectile dysfunction problems at 21, that means since it wasn't brought up to me, that I should not bring that up in a doctor's office. And so that was my interpretation of the situation. And so that's why I have to learn to be more open about it. It didn't mean that I was a bad person. It didn't mean that there was something extra wrong with me. It is a part of multiple sclerosis, be it male or female, to have sexual dysfunction problems. There just wasn't a space for those things to be discussed. And because they were never discussed, I always kept that symptom near and dear to my heart, unwilling to relinquish it to anybody for years, for over a decade's time. And that could not be more disadvantageous to us as we're trying to find healing. So for me, just creating that level of space to have open conversation about sexual dysfunction, especially from a gender standpoint, to break down a man's pride, which can also give us trouble in general. Just learning to release a man's pride, and for the betterment of the care of your overall self.
Wow, thank you for sharing that. Jamie, could I pose the same question to you so we could hear some more about the nuances of your experience?
Sure. And I'm so grateful for Chris and Tyler, who have shared, their vulnerability and their experiences. And, when I first met them last week, when I was talking with the team, stigma was one of the very first things that we identified as a common experience between the three of us, and both our personal and professional experiences. And Tyler, I just wrote down masculine versus feminine, right? Like the idea that what you're talking about really ties into the idea of masculinity, right? Well, the thing that I see in my area of work, which is maternal child health, is the concept of, stigma when it comes to women who experience postpartum depression. And, becoming a mother is something that most women do over your lifetime. And we're told that it's going to be the greatest day of our lives. And it's going to be, the most important experience that we've ever had is to become, a mother and a parent. And a lot of times, many people, both women and people who don't necessarily identify as female have these issues where they don't feel that way, right? They have terrible anxiety. We call them perinatal mood and anxiety disorders, also known in the past as, postpartum depression. And it's really difficult to come out because you're supposed to be happy. And it's difficult to come out and say, I'm really sad. I can't get out of bed. I am having a hard time taking care of myself. I'm only taking care of the baby. I'm barely taking care of the baby. I'm hearing voices. I'm thinking of hurting the baby. I'm thinking of hurting myself. I have a plan to do all of this. And it's really, really stigmatizing and really difficult for women to say it to their family members. It's difficult for them to admit it to their friends. It's difficult to even sometimes get out of bed and get to a doctor. It might even be difficult to realize that you need to go to the doctor and have this taken care of. And when we look at the numbers of women and birthing people who experience this, it's as high as like 1 in 7. That's my dog in the background, by the way. Chris has his squeezy ball. I've got my dog. So, I think that the conversation of stigma is really important. We are seeing increased conversations about perinatal mood and anxiety disorders and mental health disorders. President Biden was talking about it the other night in the State of the Union address. And it's something that, I have hoped that we're addressing more in my field and my line of work, but it's incredibly stigmatizing, for somebody to have to come out and say all of that and to admit that and to ask for help.
Agreed. We appreciate for all three of you your willingness to share. These are such powerful starting points and stories. It's similarly powerful to sit with you and learn from these stories. So we appreciate your willingness to engage in this way with all of us today and everybody who will watch this video down the road. There's such power in the vulnerability that you're offering to us. And obviously that's an important skill for an advocate because of the impact of personal narratives, among other things. So may I ask, coming back to you, Jamie, and then following with Chris and Tyler, how you arrived at such powerful vulnerability?
Yes. So I love the topic of vulnerability. We talk about it a lot, with the three of us, and because I think it's really misunderstood, right? People think that being vulnerable is being weak. But it's really, to me, about being courageous and brave and sharing our stories authentically. And I think for me, I recognize that being vulnerable can really open the door to forming a lot of connection with others. For instance, I can talk about women, who experience depression in their lives, or I can give you numbers on how many women were abused by intimate partners. But it makes more of an impact when I say, hey, when I was in my 20s, I found myself in an abusive relationship and I didn't know how to get out of it. Or I had postpartum depression after I gave birth to both of my kids. And, I find that when you can say to somebody, I don't know your exact experience because I'm not living in your life or in your body, but I've been through something like that and you're not alone. It's really powerful to be able to validate somebody where they are. It doesn't necessarily mean that you have to have that experience in order to relate to somebody. And you can definitely have compassion and empathy from somebody, even when you don't have personal experience. But I find for me, and there's always, there's always an appropriate place to share these things. I know as a nurse and a healthcare professional, I'm not always sharing my personal experiences because it's not about me. But I think that I've learned over the years, the moments when it's okay to say to somebody, hey, I see, that you're experiencing something, and let's talk a little bit about this. And sometimes sharing your experience can be appropriate. And that's one of the things that I love in my line of work, is how support groups and peer support can really, really be helpful to people. So vulnerability is definitely a big area. And, I think I also see it, when we look at my line of work, where we're learning more about, maternal health complications, stories are better than statistics, without a doubt, every time. And to me, if you can, tell a story, or a survivor of something, or somebody who's experiencing something can share their story, and a healthcare provider can connect that and make that connection, that's going to make an impact, not only for the care of that particular person at the time, but the people down the road that they're going to be taking care of. So, it's hard to be vulnerable. It's really, really challenging sometimes. And you really put a lot out there. I know a lot of people who are very particular about where they will share their stories and with whom, because of the stigma that goes along with sharing your story sometimes. But it can definitely open up a whole different world of connection. So I try to embrace it, and just make it part of my experience as an advocate. Thanks for talking about it too.
Absolutely. And you're making these wonderfully astute and impactful, shareable points about the power of narrative, because that is how humans make decisions and understand the world. But also, at times, when one is an advocate, the need for boundaries on that narrative sharing, because not all spaces will welcome our stories. So we thank you very much for sharing that. And appreciate the heart emoji, Tyler. Chris, could we come back to you with the same question of how you arrived at such powerful vulnerability?
Yeah, absolutely. Jamie, everything you said was so well said, so thank you. Honestly, this vulnerability is part of my healing journey, and that's where I'm at this point of so much of my life there, because of all the stigmas that have been placed against transgender folks or non-binary folks, gender queer to encompass everybody. I've learned a lot to hide parts of myself and to hide what I've experienced and what I've gone through to just make it through the moments. So now kind of putting my story out here and being vulnerable is part of learning to reclaim my voice and take up space again. Right. And when we're looking at gender, that fear of taking up space is it's intersectional, because I was socialized as a woman, as a girl growing up, and I was expected to conform to those gender stereotypes. And I also had a lot of bullying in my childhood because I was just naturally different. So all of those have taught me to just take up less space and less space. So when folks see me today and they see who I am now, they don't quite understand the depth of why I am the way I am. And that it's all this history coming together. And so go ahead, Brad.
No, I was just going to say thank you for sharing that. Please tell us more.
Yeah, well, so I know we talked about the importance of therapy throughout all of this. I wanted to bring in therapy. And, part of the guidelines in order to transition, there are two main guidelines. There's the Harry Benjamin W. path, which is a national, like the global guidelines on how do you work if somebody identifies as transgender, how do you go through the process and what are the requirements? And then wherever you live, there's going to be those laws as well. So part of those global guidelines is you have to seek therapy. In order to start hormones, in order to do any sort of surgery, you need to do therapy. And oftentimes, back then especially, it was you need to do 1 year of therapy and live as the gender you want to transition to before you can even start hormones. So when I originally got into Peace Corps, I had asked for a year extension to transition before going to Peace Corps. And unfortunately was not able to do that. However, I went to my first therapist and sat down and explained this whole thing of, I want to do this. I understand there's these timelines. How can I work with you to make this happen? And it was because I was able to come with her with all this information that she was able to work with me, right? So I shared that to say knowledge is important to understand what policies those individuals have to follow and what guidelines is important. And I am so grateful for meeting that therapist, because she was the first person who kind of like told me or was able to see my life for what it was and helped me see patterns I hadn't understood yet. However, I have been in and out of therapy for 10 years, and many therapists I've met in between did not click with me. So it's okay to fire your therapist. If your therapist doesn't click with you, it's okay to fire your therapist. And it took me almost a decade to find the therapist I have now, and she is fabulous, and getting validation from her of who I am is okay. And especially because she meets a lot of those identities that I hold as well. It is wonderfully validating. So, yeah.
Thank you immensely. And among the things that are incredibly powerful and important about your narrative is you so insightfully make this point on a regular basis about how part of advocacy is understanding how systems work, and thus a little bit about why, say, a provider might be behaving in a certain way. But by understanding the system, you can have a little more influence on the situation.
Absolutely. And one thing you sharing that reminded me is stigma oftentimes is out of ignorance, and not malice ignorance. People just don't know what they don't know. So it's unfortunate that it involves a lot of educating on ours, and the onus is on us, the patients, to advocate. And if you're able in the moment to find grace to try to advocate from a moment of compassion, tends to go a little smoother. Not saying it's possible all the time, but that if possible, it helps.
Absolutely. Yes. Thank you for that addition. And also just for recognizing, as everybody on this call experiences, that being your own advocate is exhausting. It's a kind of work, and you all are doing it every day in everything you do. Tyler, may I shift to the same question to you about how you arrived at such powerful vulnerability?
Forgive me, I was taking notes. Dr. Love, I was over here taking notes. I don't know if we're supposed to be doing that, but I hope y'all are taking notes as much as I have from Jamie and Chris. For me, I was always hit with the slogan growing up, what goes on in this house stays in this house. And that's kind of like from birth. I don't even know why that even comes up. But it already made a level playing field, kind of, those things that are near and dear to your heart, or what you're feeling emotionally, cognitive, those things, you don't let those things out. So then you couple that mindset and that heart set, and then get diagnosed with something. With multiple sclerosis, literally one of those underlying things that can debilitate your body is the amount of stress that you have. And it also leads in other factors, even if MS is not yours, the stress. So imagine we all have this disease that has come into our lives, but then we haven't learned to unpack the stress, the weights, the trauma that life has held over our lives. And then we're trying to combat something that's new. That's hard, right? That's asking a lot out of yourself, out of your being. And those are the things that I found myself doing, because before MS came, Tyler hadn't addressed a lot of the things that took place in his adolescence that he kept near and dear to his heart. Even those little things that hurt or that scarred, I hadn't addressed the wounds. Therefore, I was bleeding all over other people. Makes sense? So what I found was that finally getting to a therapist, doing what went against my culture as a male, as well as within the Black community as a whole, it was a great leap of faith to get there. It took a lot. It was not easy. It hurt to do it. So much uncertainty on the other side. But at the same time, you won't know those things, or you won't know what Chris is talking about, which is on the other side, if you don't take the leap. I had to learn to take the leap. And what I found is that, you see, your brain can't go through a renovation until your brain can go through a renovation with therapy. And when it does, your heart will receive a transformation. That's what it is. And I feel like we're always trying to get to a greater level of heart set to make room for a greater level of love. And I felt like that was what was necessary in my walk as a Black male, as a male battling MS. It was, I have to make room for love in my heart. I have to let people love on me to help me through the process. I didn't know how to do that. There are people who want to love on us. And then I didn't understand how much of a need it was to let my heart be free, to love on other people. And those were things that were gifted back to me. And they were a remedy that even a medication couldn't provide. All of those things were birthed to me from going out and seeing a therapist. And by the way, now is as good of a time as any, because we are all affected by trauma right now, where the people on the outside who aren't a part of this call will admit we've been living through a pandemic. We have loved and we have lost. So now at least utilize your healthcare, leverage those therapists who are out there, because there are programs that are in place to be more sensitive to us, to be able to deal with the traumatic experiences that we all have been experiencing. But you can't keep in what needs to come out, because when it comes out, that's when your healing can take place.
Beautifully said,
That, like,
Tyler.
one
Thank you
line
for
of
sharing.
like,
Please.
sorry, I just wanted to add, like, I have to remind myself constantly I'm worthy of love. So thank you for saying what you shared, because for anybody else, if that helps, remind yourself, if you're feeling insecure, it might just be you don't think you're worthy of love. So if that helps.
Thank you immensely, Chris. That's where I was going as well. We're here to appreciate the three of you and each other as advocates who move the world forward and say things out loud, as you all are doing, that need to be said out loud, because that's one of the ways we knock down stigma. Jamie, I see you unmuted. Is there something you wanted to add to that? Okay. If we could continue on the topic, Tyler, I'd like to stick with you for a minute to ask you to extend that story a little about how those experiences got you into advocacy. And the same question I'll pass to Jamie and Chris after. And specifically, as you think about what got you into advocacy, we'd love to hear about the positive changes you've seen in your experiences.
So Dr. Love, I didn't know the term advocacy. Can I be just human and honest? I didn't even know the term advocacy. What I thought about was something my grandma used to always say. And she used to always say, baby, please leave things better than the way you found them. She would say, please, your job is to leave things better than the way that you found them. And I remember how I found multiple sclerosis. And I remember the navigation and feeling so alone, and knowing that Montel Williams was the only other Black male that I knew of, because I was a child of the 80s and grew up with 90s talk shows with Ricky Lake and Montel and Jerry Springer. And so I was like, oh my gosh, okay, Montel Williams is talking openly about multiple sclerosis. So that must mean it's okay, but I don't have access to Montel. And I just needed somebody who was a male to speak into my life and just say, hey, it's okay. And I never found that person. And so grandma said, leave things better than the way you found them. And so my job then, I knew, was to make my story visible and to begin knocking down those walls through mental health breakthroughs, so that my story could be present and people could receive that most authentic me, even in those titles of erectile dysfunction and loneliness, to know that you are not an outlier, you aren't an anomaly, that it's okay. And when I started doing that, because it took me time to get there, the years for erectile dysfunction especially, probably my proudest moment was hearing from another Black male who wrote me an email. It was the first one I received, and he said, I have been living with this for so long, with erectile dysfunction, and you finally gave me a platform to say, I am not alone. That was one of the more special moments in my life because of what I let lay dormant. Because I released it, it gave somebody else hope. And that's for me what we all live as advocates.
It is indeed. And we're here with you. We're here with you today. Thank you for sharing that. It's a lot of things that we all need to hear and sit with. So this is a beautiful, mutually supportive group we have, to say the least. Jamie, could I also ask you to share a little bit about how your narrative turned into advocacy and
Sure.
what positive changes you've seen?
Sure. And I just wanted to touch on the idea of hope, because I love that idea. I've had experiences where hope looks like different things for different people, right? When my mom had cancer, we knew really early on, or I knew really early on, that this was not going to be something that she would survive. And so my hope for her was that she would live well in the time that she had, and that our family would be able to, spend our time together. And she was able to see me graduate nursing school and have another baby, and she did really live well. And so hope does look different for everybody. And so I do have I'm a very hopeful person. So I do have a lot of hope. So thank you, Tyler, for bringing that up, that concept. But for my advocacy journey, I don't know how not to be an advocate. My mom was a teacher. My Mimi was a nurse. And so it's in my blood. And I feel like just so blessed, because I feel like it just kind of comes out of me, But with regard to my work as a maternal child health advocate, I was really impacted by seeing women firsthand at the bedside experience complications related to their pregnancies and their births, and hearing their stories. And I was really moved to act really early on, I think, in my career as a nurse on this particular issue. But for me, it started out small, because I was a second career nurse. I didn't, get onto the floor as a nurse until I was like 38 years old. And as a newer nurse, I didn't feel like I had enough knowledge and experience to fully speak to the scope of the issues with credibility. And I found myself frequently asking myself, who am I to think that I can advocate in this space, right? And I am like the queen of the, imposter syndrome club. So that's with me all the time. But so in this case, I started out just by reading and listening and consuming and learning. And then I started to talk about some of the issues that I'm learning now. But I also recognize that, I've had a lot of opportunity in my life, and that my work as an advocate is a chance to use my privilege to make things better for those who haven't had the same opportunities. And one of my nursing school professors, shout out to Dr. Robert Atkins, reminded me when I graduated that a lot had been invested in me over the years, and in my years of schooling, and that I should use my career and my power as a nurse, as a trusted professional, to really honor that. And I really took that to heart, and I internalized that. And I think about that almost every day. And so some of the positive changes I've seen, there have been a lot of developments in the last few years in the area of making improvements to maternal child health. But I think that it's also really important to recognize that there have been people working in their communities for many, many years who have been doing this work to make things better. And I'm encouraged and hopeful by the amount of attention and funding that are flowing into this work to make improvement in maternal child health outcomes. But we have a lot to do, especially in the area of improving outcomes for Black and Indigenous populations. And we need to be able to support these organizations that have been doing this work for a while now, and to make sure that their voices are being uplifted and centered. And so that's my, it's getting better, but it's my hope that, we really have to do a lot more work to make things better for those particular populations. Thank you.
Agreed. Thank you. Again, so many powerful themes in there, including the one about using privilege to knock down stigma. That's part of the opportunity, and I would argue obligation and responsibility there is to be part of solutions. Chris, could we turn to you with a similar question of how your journey turned to advocacy and what positive changes you have seen.
Absolutely. I would say I don't consider myself an advocate either. Like Jamie, I have imposter syndrome of whether I should be speaking in the gender queer space, even though I am. So that is very real. It's very much, I don't see myself as an advocate because in my mind, an advocate is someone who's in DC, who is like picketing fences, who is trying to change policies and taking on these big systemic changes. Whereas I am just trying to make life easier for myself. And if I can help other people along the way, that is fabulous. But a lot of times, the barriers I'm meeting are so many, and I only have so much energy that I need to prioritize and do what I can given the resources I have in that moment. So for sometimes that is creating this systemic change where folks behind me are not even meeting that barrier, that resistance at all. And sometimes it's just finding that solution for me in that moment to be able to get to the next step. Because something I think many folks who see themselves as advocates might forget is we only can fill from our full cups and we need to prioritize ourselves at some point. And there's only so much energy we have to be taking on every battle we meet. So some positive changes, the biggest positive change and the biggest impact I have made has been essentially a human library for others to ask questions. And that's the big thing because when someone doesn't know something, it's very easy to get intimidated and unsure where to start. And Google, Dr. Google or Google for whatever, has many answers, but those are all through their own lenses and biases and sometimes just plainly incorrect and propaganda in some way. So being able to be a resource for others has allowed me to kind of create that low-key grassroots movements and create space where people feel comfortable to ask these uncomfortable questions or things that they don't know how to even put into question, quite frankly. Because when you're talking about something like gender, it is such an abstract idea that how some people don't even know what they're trying to ask or what they're missing. And it's hard to search for that. So my biggest advocacy points have been being a resource for others to ask questions, trying to just, change the obstacles I'm meeting. And if there's a systemic change, then that is amazing. And, trying to be there for others in ways that people weren't there for me. Because I remember how that felt and how lonely that was. So even if it was just one example we had on, in my undergrad, we had someone of a queer person hang themselves and successfully complete suicide. And there were two other trans folks on that in campus. I was a senior at that point and they were both under me. And one of them, even though this person despised me, could not sleep. So they came up and said, hey, I can't sleep. So I spent 2 nights just driving around so they would sleep in the car because I wish somebody had been able to do that for me when I had those nights. So it's advocacy is, I don't think of myself in that big term advocacy, but it's these small everyday interaction advocacies because those are the vulnerable moments where you can truly change how somebody sees something because they're coming to you as well with that open mind.
Thank you, Chris. We treasure you, and we know you're an incredibly powerful advocate. Lobbying DC or no, every time you share your story, somebody else's life gets better, including all of us here today. And the same is true, Tyler and Jamie, for you sharing your stories.
You're gonna make us cry, Brad.
That's what the 3 of you have been doing to the rest of us for almost an hour. There's no way to summarize intellectually what you all have just shared in thinking about the power of narratives, in thinking about the power of vulnerability and how we arrive there, as well as the importance of understanding systems, because those are often the inflection points where advocates can do the most work. So thank you for guiding us in this way. Thank you all 3 for being real and authentic, because the other 78 people who were on the call benefit from these stories, and you help inspire us as we do for each other, for sure, in our own advocacy work. The empathy and authenticity that you've all shared today, is so moving, I'm finding it difficult to take deep breaths. So thank you for being here with us, and thank everyone for attending. As a reminder to everyone, you are welcome to visit the advocacyexchange.com, where you can watch recordings of sessions as well as more details about the upcoming April 7th session. Also, one quick reminder, if I may just ask for a small favor from you with the 5 minutes remaining in the hour. At the close of the session, you'll be prompted to take an Advocacy Exchange survey. And so it would be lovely if you could take the few minutes before the top of the hour to do that. But otherwise, thank you for being with us. Thank you for the wonderful support of each other and our panelists in the chat. It is a delight to move the advocacy movement forward with all of you. And we look forward to seeing you on April 7th, in which time I hope that each of you has picked up a copy of Tyler's book and spent some time learning more about the power of that narrative. So thank you for being here today.